We're here to talk about AEDs today and the Heart Association and CPR. Why are we talking about that? Well, first of all, you need to know that heart disease is the #1 killer of men and women in the United States. It's a first world problem. What happens if somebody goes unresponsive? The first thing you want to do is make sure the scene is safe. Is where this person has fallen a good place for you to help them? Because if there's a fire or it's in the middle of traffic, or you're on a sidewalk and it's an ice storm and branches are falling, it's not going to be a safe place. So you need to make sure the scene is safe. The second thing you want to do is come up to the person and touch them. Sir, are you okay? Are you all right? Take about 5 to 10 seconds to do that. And yes, it's okay to touch them because they might need that stimulus if they've just passed out or fainted. After 5 to 10 seconds, holler for help if no one's around. Help, I need help. And then check to see if the person is breathing. Is there movement on that chest? Again, take about 5 to 10 seconds to look for that. If you don't see movement, then say, someone call 911 and get an AED. Then you need to start compressions. Now, how do you do compressions? Well, women have less upper body strength than men do. It's just a fact. So what we need to do as women is make sure that our upper body is over the chest of the person who is going to need compressions. Take the heel of one hand, put that in the center of the chest, which is the lower part of the breastbone, interlock your fingers and make sure the heel of the hand stays in contact. Your arms need to be straight, don't bend your elbows. You're going to push hard and fast in the center of the chest to a depth of about 2 to 2.4 inches. We're going to count out loud and go at a rate of 100 to 120 per minute. And so we're going to just count out loud so we can keep track of our compressions. 2, 3, 4, 5, 6, 7, 8. Now maybe by this time somebody has come and brought an AED. If they bring an AED to you, you can keep doing compressions and you can even direct them what they need to do next. We need to open the lid and then power on the AED, push the on-off button. And after that, follow the prompts. Whatever the AED says to do, that's what you need to do. So you want to verify, did that person call 911? If there's clothing, we need to make sure the patient has an open chest, a free chest that we can work on. Now notice, there's no envelope
red
here.
Handle to open bag.
Normally there's an envelope that we would pull to open, but since that's been used,
look at pictures on pad.
we need to find the ones in the lid.
Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture.
Everybody clear.
Shock delivered. Provide chest compressions.
Now I'm going to stop, but if this were somebody who really needed my help, I would keep going because you're going to hear the AED prompt you to continue care, and it will do that for 2 minutes. We need to do compressions for 2 minutes, and then it will say again, do not touch patient, evaluating heart rhythm. And it will tell you again, do not touch patient, delivering shock if a shock is advised. Sometimes the AED will say no shock advised. At that point, go back to doing compressions. If you're thinking, well, what if they have a heart rate, or what if there's a pulse? You know what? You're not going to harm them if you're doing compressions and they're not responding. So if they start moving, their eyes open, they're trying to swing at you, you can stop compressions at that point. Quick access to care, which is what we're doing, is giving them hands-only CPR. Somebody's calling 911, somebody's applying defibrillator, is going to increase their chances of survival. Remember when we talked about calling for help, saying, help, I need help? What if nobody comes? How do you get help there? Because you're going to need it. Well, most of us have our cell phones pretty darn handy. I just happen to have mine in my pocket. So at this point, if this was a real emergency, I'd call 911. And then I hit dial, and then I hit speaker. And then what I can do is when 911 answers, I would just start talking and saying, hi, I need help. I have somebody who's down. I need an ambulance. This person is unresponsive. And I could start talking to them, 911, the Metro Communications, or whoever the 911 dispatcher is, and start doing compressions on that patient and still give them information while they're sending help to me.